Hi, everybody.
Hello, we are back.
Finally.
Finally.
It's been a
It's
long week, Grania, hasn't it?
been a very long week, 14 days in our weeks. Okay, so this is the
Anyways,
weekly, not so weekly dose. And I am Gra from I Am Healing, and you are?
I'm Antoinette McQueenie Homeopathy, and today we're talking a little bit more about maybe HRT, about breast health, maybe. You said something really interesting there about phones. Do you want to just start with that, actually?
Oh, yeah, because this applies to all ages. But I remember, gosh, it must be going back 15, 20 years ago, and there was a girl that I was hanging around with at the time, and she constantly stuck her phone in the top of her bra because she wouldn't have pockets or whatever. So she just popped the phone in there. And I said it to her even at the time. I said, I really don't think you should be doing that. And she just poo pooed me away. And I just thought, where is the level of awareness of what these yolks are? I mean, I put mine on airplane mode when I'm walking because I don't want to have that charge all around my body as I'm walking. So it's just, again, just something as basic as your anatomy and being aware of that tissue and how sensitive it is, and you're sticking a radiation device in it.
Yeah. Do you know there was a run in the last year for it was raising money for breast cancer awareness. So a lot of women were running, but they had these kind of like harnesses on them, and they were able to stick their phone down there.
Yeah.
Like they were running to create awareness for breast cancer to raise no, they weren't running to create awareness. They were running to
No,
raise money.
raise money.
This money that goes somewhere. So it's my dog
Yeah,
barking. Can you hear her
I can hear her. She's just joining in the chat. It's okay.
joining the chat?
She's obviously
But anyway,
passionate
so they
about
were.
breast health.
She is. Go girls. Um, but just again, the lack of awareness there that people they were doing this run to raise money and putting their phone, their radiation device in beside this really sensitive, dense tissue of their breasts. It's just
Yes.
crazy. It's creating customers. That's all it was. Um,
Yeah. And you
so
know that.
yeah, yeah, exactly. Um, so I had come across a thing during the week. Like you and I are only dealing. We're taught this chat is kind of about HRT and about breast health as well, but we're really only dealing with people who are having problems with HRT. We're not dealing with people who are doing great. Okay,
Yeah.
and but we're seeing kind of sort of similar problems coming up again and again, and we're not seeing hundreds of women per week. We're only seeing a small number of people, but it's funny that they're coming with these problems that are really, really rare.
Yeah.
Rare.
Rare.
So I would just encourage anybody who is considering HRT or who is on HRT at the moment to please look up the HSC website and look up the side effects of HRT. And there's quite a list. And it talks about the side effects of the different hormones, synthetic hormones. So, there's headaches and there's breast pain, tenderness, vaginal bleeding, diarrhea, hair loss, mood changes, depression. These are all in the common side effects, which I know people don't really, go into all that much. But if you go right down the end, if you scroll past everything and it says more serious risks, HRT has been associated with a small increase in the risk of blood clots and breast cancer. And it's the exact same wording that's on the English one. What's the English healthcare system?
So they
NHS. It's the exact
NHS.
same wording. It's like somebody has copied and
That's okay.
pasted. But it's those ones down the bottom that are really serious, and they're a lot more common than
Yeah.
than people realize. And it's the breast cancer and it's the changes in breast tissue that I've seen most often. Also low mood depression.
Yeah.
Um,
And the
and
hilarious thing, just with the mood and depression, sorry to cut across there, if for any of you who remember the Davina sales pitch of HRT, because that's what it was if you watched it. One of the big sale ticket items for going on HRT was severe depression and mood. And yet, this thing that is supposedly going to rescue you from that may actually be aggravating it. And
Yeah.
it just, it's just mind blowing that. And at the end of the day, it is the only solution they have for that or antidepressants. We know that they've only two options for us women in menopause in the allopathic healthcare. So that symptom alone is just. I have a lot of clients who would come to me for that, for the mood. The anxiety is ramping up as they go into perimenopause, sometimes depression with that anxiety, and it's all getting more and more and more and more. And they're looking at this magic pill that's going to save it all. And yet, one of the side effects is the very thing they're trying to address.
So I think we really have to be advocates for ourselves if we're taking any kind of medication. And that includes homeopathy, it includes all the holistic stuff. We still have
Oh,
to we can't just subcontract our health and everything that's going on in our bodies. We can't subcontract that out. That's an inside job. So we really need to be checking in and seeing are there any changes going on? If you're on HRT, I would really, really encourage you to at least once a month see how your mood is. Keep a journal, maybe. See how your mood
yeah,
is. Um, check your breasts. And if you're not on HRT, we all need to be doing this. We need to be checking our breasts and right throughout the month and not just, maybe once a month because our breast tissue changes the whole time. And what feels absolutely fine, maybe around ovulation, might not feel fine around your period. But if you're familiar with what your breasts are like and you're not afraid of them, and we have been conditioned to be afraid of our breasts, haven't we? And we're
yeah,
having a feel to see is there anything there, it's done in fear and
yeah,
horror, like we're just waiting for our breasts to turn bad. And there's a reason for that. So it's not such a shock then when 25% or 45% of the shock of the population are getting breast cancer. It's like, oh well, that's common. I
yeah,
don't think it should be as common as it is. um
no,
so yeah, don't be afraid. I think checking your breasts and maybe send them a little bit of love if you do Reiki or healing or anything.
oh
And you
yeah,
don't even need to do that. If you're in the shower, just hold them and say, I've got you girls, I'm looking after you.
yeah.
I'm not afraid.
Yeah, it's even just that thing of, checking them can be massaging them, and it's a great, we have the lymph just under the armpits anyway, so massaging that area is going to be so beneficial. And it's falling in love with our bodies. We haven't been shown that, and as you say, it's like
Yeah.
grand, that ain't gonna
That's
work,
like a
darling.
that's like a pat down at the airport.
Yeah, no, by the way, I don't want the airport turning it into a breast exam either. Get your free examination. Two for the price of one. Oh God, I'm gonna go red. Yeah, no, and I think because our bodies are changing with menopause, and so it's like no, our girls are still, they're still us, So it's really important to be checking yourself, to be aware of your entire body, aware of changes that are happening through this phase, so that you can harness the power that is this rite of passage through menopause.
Yeah, yeah. And one of the things that a lot of people notice is that they're because estrogen, the hormone that we're told dies off, that it in perimenopause doesn't die off.
No,
It can actually be up and down for quite a while during your perimenopause years, and it's the growth hormone, and your breasts can get bigger,
yes,
and that's actually one huge benefit for some of us anyway. My girls worked hard at breastfeeding three babies, so we're just and they got a real little boost. But because it is a growth hormone, things can grow quicker, especially with synthetic hormones. So
yeah,
tumors can grow much, much quicker. And I've had people say to me that they were only on HRT for a month and already their breasts were rock hard. They've gone up 2 bra sizes. That's not right. That's not normal. Don't wait for that to settle down.
yeah,
Regardless of what your doctor says, that needs to be checked, and not necessarily with harsh mammograms where you're
mm,
squishing your breast between two metal plates, causing trauma. Trauma causes tumors. But with maybe thermography or something an awful lot more gentle.
Yeah, I again, not to frighten people, but mammograms, they're actually banned in Switzerland now. We know that. Many people listen to this may not know that. And there are some lovely thermography clinics in this country. So it's really worth, if you're that concerned, to go and have that looked at. Um, I was going to say, bring it to the other side though as well. I have a couple of clients who are navigating breast cancer, and I don't want to. I'm just going to say that homeopathy is lovely alongside whatever treatment you decide. And so it's not, everything doesn't have to be this big frightening thing. The remedies can help hugely alongside. But again, one of the things, I think you may know this, at the end of breast cancer treatment, they often put you on this medication. Again, it's synthetic hormones. And it's apparently to help you, but actually the percentage of how it helps is so low that actually when you research it, it's not worth taking. But the side effects of this medication are huge. So it's just again to bring more awareness to that whole area. But homeopathy is so supportive. And yeah, it doesn't have side effects.
Yeah, exactly. We have lovely protocols, like you said, to
Mm.
use alongside radiation and chemotherapy, and remedies to take after a mammogram if you have to have one. Uh,
Yeah,
remedies to help with skin burning and nausea and all that sort of thing as well. But before hopefully it gets to that stage, maybe just yeah, keep an eye on the breasts. They're a really important part of our bodies and not something that we should be terrified of.
yeah.
Um, you know,
And bringing it back, I guess, like, look at the garments you're wearing. Make sure your bra is fitting. Make sure your girls are comfortable. You don't want them poked and prodded, and like, that's not supportive. You want them in, okay, yeah, we all want to be sexy and frilly stuff. Not all of us, but some of us. But it's just to make sure you're wearing garments that support you and look after your girls, and not um, hurt.
yeah, and to get the bra off as quickly as you can in the evening because it can block lymph and all of that. And I just remember estrogen, what I was talking about, excess estrogen in the body can make the breasts bigger, and but it can also make the breasts more tender during perimenopause. And that's kind of whether you're on HRT or not. But a way to get rid of the excess estrogen that's causing discomfort is to poop it out. So make sure you're not constipated. So make really focus on getting lots of green veg, lots of fiber back into the diet if you haven't been doing that already. And it will get rid of all that extra estrogen that isn't being needed. You can't store it. Well, you can in breast tissue, but you don't need to be storing it there.
Yeah,
It can be removed or gently removed.
yeah, yeah. Brilliant.
Okay, well let's leave it at that. Short and sweet.
Short and sweet as always, and we'll see you in whatever our week becomes for the next
Next
one.
week. See you next week.
See you next week sometime. Thanks, everyone.
All right, bye. Bye.